Did you know that African American males between 30 to 50 have the highest risk of developing gout? How about the fact that pseudogout cannot be prevented in people beyond 60? We have more to tell you in this gout versus pseudogout video. Let us get started. Number 7. The cause. Of course, you should be worried about joint pains. Gout and pseudogout are the leading cause of joint pains in the average American. About 3% of people in their 60s have it. After 60, each decade doubles one's chances of getting pseudogout. With gout, about 4% of all Americans leave with the condition. So it is no small matter. However, you do not feel pain and start saying that you have gout or pseudogout. Proper diagnosis is required to conclude, especially since some of the symptoms of pseudogout may never show in older adults. The diagnosis procedure includes examining the fluid from the affected area or X-ray analysis of the joints, and properly medicating the situation. We will shed more light on it later. On one hand, gout is caused by monosodium urate crystals in the joints. The crystals form due to high uric acid levels, a purine product in foods in the body. The crystals form around joints. On the other hand, pseudogout is caused by calcium pyrophosphate dehydrating crystals deposited in the tissues of the joints. However, they affect different parts of the body's joints. Number 6. Affected areas. One key difference between these two is the affected areas from the onset. They could affect several parts of the body, but primarily, they are noted for affecting the same spot. Gout affects the heels, wrist, or fingertips. However, 50% of the cases start from the big toe. To illustrate, the small joint at the base of the big toe is the most common point for gout attack. The toe can become so large and red that you might have to tie red cabbage leaves around it for comfort and healing. In the same light, pseudogout starts from the knees. As we mentioned, the calcium crystals assemble in the knees of older people. In other cases, the ankle, wrist, hip, and shoulders could be affected. Combined, the symptoms are similar and sudden. There is a rapid pain followed by warm, swollen, reddish tender skin on the joint. The joint can get too hot to touch in the process. The symptoms last for days and weeks, and it is advisable to reduce the pressure on those affected joint areas. Number 5. Diagnosis. The first step to dealing with a disease is finding a diagnosis at the rheumatology department. Many people notice swelling in their feet or knees and know instantly that they are dealing with gout or pseudogout. Except there are 100 arthritis conditions that could be diagnosed. Similarly, there are pseudogout symptoms that align with gout symptoms. Therefore, the lab is the best way to find out precisely what you are dealing with. First, the doctor will draw fluid from the affected area and examine it under microscopic observation. The crystals are viewed in special polarized light under the microscope. Here, the difference becomes apparent. Pseudogout crystals look rhomboid-shaped. Gout crystals look like needles. Furthermore, pseudogout crystals are positively birefringent, while gout crystals are negatively birefringent. Again, an X-ray helps to differentiate the two types of arthritis. Pseudogout deposits calcium crystals in the soft tissues around the joints, while gout eats away at the bones and joints of the hand and wrist. You may also see some cystic erosions in the bones at the affected joint surface. Speaking of cystic bone erosions, there are more health impacts of gout and pseudogout, including chronic disability and acute incapacitation for weeks. We will get to that in a moment. Number 4. Risk factors. What is the risk factor of not subscribing to this channel? You miss all the juicy medical information. So go on and hit that button. The risk factors for gout and pseudogout are pretty similar. For instance, if you have been injured near a joint, you're a high risk for both cases. Family history and age are high on the risk factors too. Indeed, if you develop gout, you are between 30 to 50. Men are more likely to develop the condition than women are. In addition, black men have a higher risk of developing gout than Caucasians. We wonder if pseudogout could get canceled for racism after this information. We hope not. In contrast, age and family history are the only things that matter regarding pseudogout. All genders and races have a similar risk. The critical point for pseudogout is being above 60 years and accumulating calcium crystals. There is no prevention for pseudogout, as we shall talk about later. Number 3. Health impact. Pseudogout affects about 3% of people past their 60s. Once you make it into your 90s, you will have a 50% chance of chronic pseudogout. For instance, people in those age brackets can be incapacitated for weeks in their knees. Additionally, the crystal deposit can cause severe joint degeneration and chronic disability. In comparison, gout is credited with cardiovascular risks, including hypertension, insulin resistance, renal failure, and dyslipidemia. Joint deformity, kidney disease, and psychological problems are also nearby to gout impacts. Notable about these health problems are tophi. Tophi are clumps of urate crystals that harden under the skin and affect ears, ankles, hands, and feet. These health impacts are terrifying in the long term, but we can find remedies for the situations. Later, we will speak of cold therapy, resting the joints, and elevation to reduce the pain immediately. On the other hand, there are fractures, infection, rheumatoid arthritis, and osteoarthritis, which can have similar impacts as gout and pseudogout, that could be mistaken if there is no proper diagnosis. Number 2. Treatment. We can get into pseudogout treatment and gout treatment now. Without a correct diagnosis, you could be unsure what treatments work best. When you suffer from pseudogout, non-steroidal anti-inflammatory drugs can reduce the pain. The doctor can recommend over-the-counter drugs like colchicine and corticosteroids. The same medications can be prescribed for people with gout. However, opioids are not allowed when you have gout. In addition, the prevention methods of the two are different. A healthy lifestyle can prevent gout. Weight loss is the #1 suggestion for gout prevention. In addition, avoiding foods with purine is a close second. Limiting red meat, fish, beans, and some high-purine vegetables can prevent or treat gout. Replacing alcohol with coffee and water is key to preventing and treating gout. Do you know anyone who successfully treated gout with a healthier lifestyle? Let us know in the comments below. Meanwhile, one cannot cure or prevent pseudogout. It comes with age and evenly between sexes, so there is no escaping it, especially if you live past 85 years old. Roughly 50% of that population suffer from chronic pseudogout. Maybe Socrates was not wrong when he said, "Death may be the greatest of all human blessings." Nevertheless, so was Sri Ma when she said, "Do not desire a long life or an early death." Number 1. Remedies. A refreshing beverage made of apple cider vinegar, lemon juice, and turmeric can pleasantly cure the pain in your foot. You can also freeze red cabbage leaves and tie them to your toe. Hydration is another quick way to flush out the crystals. Milk and cherry juice helps too. Overall, a dietary switch is the best remedy for gout. On the contrary, there are a few things a person can do to treat pseudogout at home. Lifestyle does not prevent much, but resting the joints helps. Staying off the joint for a while can help ease the pain. Ice packs can reduce the inflammation that comes with your swollen knees. Over-the-counter NSAIDs like ibuprofen and naproxen sodium are helpful too. Our next video lists the top 10 best food diets to deal with hyperuricemia for diets preventing and treating diseases.